Management and histobacteriological findings of mucosal fenestration. A report of 2 cases. This presented by Ricucci in 2018 in Journal of Endodontics. This case reports highlight 2 rare instances of mucosal fenestrations where the apices of necrotic teeth becomes exposed to the oral cavity. And also it explored the management using combined non-surgical and surgical treatment. In the first case, patients presented with a lateral incisor with diagnosis of pulp necrosis, and in the second case it was a trauma case of a central incisor. Both cases were presented with mucosal fenestrations and were managed successfully with non-surgical approach followed by surgical approach. For the histobacteriological findings, there was an extensive apical resorptive change in both cases. Also, both cases presented with bacterial biofilm growth that covers also the resorptive defects. In some areas, this bacterial biofilm presented as calculus. Interestingly, there was minimal inflammation that surrounded the bony crypt. And according to the authors, this was explained by the segregation of the root apices from the alveolus, which led the inflammation to escape and not being confined to the area of bony crypt. I think this is an interesting paper, and it provides information about the disease that we are treating on a daily basis and how sometimes it presents itself in unusual ways. And I think it is also important for us to come up with protocols to manage those cases in terms of non-surgically, how to deal with irrigations and how to deal with medicaments. Also, for surgically approaching those cases, and the histology also provide us with a further understanding of what's really going on in those cases.